I know you worked with your colleague at Duke, who's a thought leader in astatine, but there are obviously a lot of different radioisotopes that you could have chosen to work with. Tell us a little bit about why you chose Astatine-211 as compared to any of the other either alpha or beta emitters.
Yeah, that's a very good question. So I work with Professor Michael Zalewski here at Duke University at the Radiopharmaceutical Chemistry Lab, and indeed we have been the leader in astatine in the world for many years, and it's quite simple really. Astatine is the cleanest of all of the alpha emitters because it only has one alpha per decay, and it does not have any radioactive alpha emitting daughters that could cause off-target toxicity. And that's one of the biggest advantages because that will give us a cleaner and more tolerated dose profile and toxicity profile. So you can give patient more dose with less side effects. And the other advantage of astatine is that you can produce astatine on the medical cyclotron, on a cyclotron facility on demand. So as long as you have a cyclotron facility in place, you can have astatine anytime you want. And for pharmaceutical companies and biotech in general, having a very reliable and robust logistics to support their clinical trial and commercialization is really vital to their success. And the last thing that I do want to mention is that astatine is the only alpha emitter that can provide you with a qualitative and quantitative imaging aspect. So you can directly image astatine, and you cannot do that with actinium. Well, you can do it with lead-212, but the quality of the image really doesn't give you a lot of information that you need for dosimetry calculation, right, which is later emphasized by the FDA and by a new announcement just last few days.